The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Good afternoon. Welcome to our weekly update webinar. So this week, since we don't have any guest speakers and we're opening it up for questions and discussions, I'm not going to leave everyone muted. I'm going to go ahead and go down the list and unmute everyone. But while I'm doing that, we actually already have a question in the box. So I will read that and then hand it over to Tammy. Has anyone created a quarantine or testing policy for staff returning from vacation or hotspots?
Oh, that's a great question, and good afternoon, everyone, and thank you for joining us. Today I just have one update, and we're going to open it for everyone. I do not have an answer to this because I have not heard of anyone creating a quarantine plan. Does anyone want to share anything that they've done or developed on this? So if not, I will do some research and I'll see if I can't find something that's been done on this, and then we will post that on our website for everybody. So the one update that I have for you is based on our call last week and the concern and discussion over Department of Health and Liquor Control Board doing inspections and not following the guidance that we were given by the Department of Labor and Industries. So Jan and I both have reached out to various agencies. Jan reached out to Department of Health. We shared with them our guidance materials, the information that we had, along with the counties that you all had identified as not being clear on current guidance. So we let them know. Susan, who has been on our call before, is the person who is coordinating this. She's going to reach out, or has reached out, to all the Department of Health, Liquor Control Board counties to let them know what the guidance is on masks, and specifically that shields are allowed as long as they have the coverings on the side and the bottom. So that is being clarified to make sure everybody's on the same page. And with that, I am just opening it up, and I welcome questions or anything else we can hopefully answer. I'm still waiting to get good guidance for us on what we're supposed to do with the employees that can't wear masks. I know a lot of people, have laid them off. I actually have a meeting scheduled with a law firm tomorrow to see if we can't get a better legal opinion, because the governor's office just is not giving any guidance at all on that. So with that, I'll open it up.
And everyone's been unmuted, so should be able to talk.
Any questions for us? I can't believe we've finally come to a moment where we actually think we have some of these answers under control. Masks, I think, has been the huge one. We've been getting a lot of questions about the restaurant deli situation and some of these coffee shops that are in some of the stores. Has anyone had any issues or concerns with that? Okay, this is great.
Tammy, this is Kevin, and I do have a question. I know we talked about it, but I can't remember for sure, on bulk foods and the non-gravity fed, the scoop kind.
Yes.
What's the guidance on that?
Okay, so that is posted on the website, and I know you have to change out the scoops. I believe it's every hour or 2 times a day. I will get that guidance for you. It is posted on the website, so you can have that easily accessible. So we do have that for you. But yeah, it's mostly about changing out the scoops regularly.
Okay, I'll look it up on the website.
Yeah, I'll find it for you and I'll send it to you specifically so you've got it right in front of you.
There's a question in the box. Is the restriction on food demos still in place?
Yes. I have not seen any new guidance on food demos.
And then we also, someone sent a question to Jan a few hours ago, but she's going to find it and copy it.
Oh, perfect.
We have another one. Anyone found a face mask with mask that is more affordable? The one from Bellingham is $65. Not.
Oh, yeah. A few of you on the call have found some masks or shields. Masks?
I think they're talking about shields.
I think so too. I know that there's been some on the phone here that's found some more cost effective and or made their own.
Oh, he said shield. He meant shield.
Okay, good. That's what I thought. And I'm not sure how much the ones were that we posted on the website. Anyone want to share where they found some or any? I can't believe that we can't find any cheaper than $65.
I thought the one someone shared from Amazon was around 30, but I might be remembering that incorrectly.
Yeah, I'm happy to reach out to some of our PPE sources and see what kind of rates we can find. I know everybody's been out there searching for them, so certainly I'm happy to reach out to some of those sources and see. I think people are getting really creative now that L&I has come out with guidance that we can have the shield with the covering. So I think you're going to see more and more options out there, but I'll see what I can find and I'll post it on the website.
Okay, we have an employee that lives with her mother. Her mother works in a fruit packing shed and has a fever and cough. She has been tested for COVID and is awaiting the results. Our employee has not been to a doctor. Our employee is not eligible at this point for the federal paid sick leave since she does not have a doctor telling her to quarantine, nor does she have a bona fide need to care for her mother. She wants to continue working. She has 14 hours of accumulated time off with pay that she can use. Our employee is asking us if she should work. What's the appropriate response to this? One step further, if mom tests positive, would the answer change?
Okay, so I was trying to listen to that. Is mom the one with the fever or is the employee the one with the fever?
Right. Mom has the fever and cough.
Okay.
She lives with her mother. Mom has the fever and cough, but she hasn't gotten the results from her COVID test back yet. So the employee wants to still be working. Is that what should?
Okay, the employees, if there's no known exposure to COVID, then that employee can work. If the family member has been exposed to COVID, a quarantine would be wise, but there's no specific requirement on that. Now, once the family member tests, if the family member were to test positive, then absolutely we do have specific guidelines for that. And that person should be quarantined. And you can find that guidance.
So I got a couple of questions. Can you guys hear me?
Yes.
So number one, any changes on bulk donuts? We were considering getting them back in, having single-use gloves available to pick the stuff out. So that's number one. Number two, is there anything that's changed on soup or soup bars? Are those now allowed? And then three, we were the ones that worried about the coffee shop, and but Jan answered that, and it looks like it's 25%. But we're still concerned about having that indoors with people with no masks. So we're not quite sure what we're going to do there.
Yeah, and I think if you can't have that 6-foot distancing, clearly identified, because I know some of those coffee shops are pretty small. It's best just to not have seating. And I know a lot of those smaller ones have just removed all the chairs because they really can't 6-foot distance. As far as the bulk donuts go, I don't have specific clarity on that. I would have to get back to you on that one. They have allowed some, but you're doing individual gloves. I haven't heard that that's opened up, but I want to be sure. So I'll have to do some research on that. I know Jan was also doing some of the food issues and the bulk food considerations. So I'll have to check on that one because I do not know the answer.
Hey, Phil, this is Kevin, and we've been doing donuts for most of the time, and we just individually wrap them. And so that seems to be working out pretty good at this point.
Okay.
Yeah, this is Chris. We've been putting one donut in a bag and then writing, apple fritter, maple bar on the bag and sealing the bag. So not cost effective, but it sells donuts.
Okay. Yeah, and that's what I've seen as well. I haven't seen any guidance that says, yes, you can just have them open, even with the use of a glove. So yeah, I would have to check, but I have not seen guidance change that says you can do that.
Has there been any discussion about what the targets are or anything to roll out the phases into from 2 to 3 or 3 to 4 or anything? Is that, I just haven't heard anything about that anymore. Is that just like so far down the road, nobody even talks about it?
I was trying to check in with the governor's office before this call, just like I always do, to find out, can we expect anything? Are we going to have any changes? And I got crickets. So at this point, I don't think that we're going to see any changes in phases. They do have their safe start measurements that they're using. But at this point, I haven't seen significant changes in numbers. And certainly the governor's office hasn't indicated they're hopeful to move anyone to the next phase. So, we've seen him back off on some things, but certainly not moving forward on anything at this point. Anybody have anything else? I know I've got some homework to do here to give you guys some follow-up answers on this. And it has been frustrating because we're not always getting the guidance that we need. And a lot of times I think they make it up as we go. So do we have anything else for the good of the order?
Yeah, hey, I'm just going to make a comment real quick, because just to let you guys notice, you mentioned that we have other agencies doing inspections besides L&I, and
yes.
We actually have a liquor agent going up to our Okanagan store to take pictures and write up a quick report on it. So that is happening. We haven't had anything in the other stores yet. So anyway, just an FYI.
Oh, yeah, that's good to know. Definitely.
Are we talking about coming in to look for people who are not wearing masks? I'm sorry, I joined the call late.
Yeah, I don't know exactly. I think what he's doing is the mask Nazis are out there pretty heavy and calling in and complaining no matter how good of a job you do.
Because we did get a liquor board guy show up at one of our stores in Seattle.
Yeah.
About people, a claim that we were not enforcing the mask requirements.
Right. And I think that's probably what he's going to do. And then, of course, the mitigating factor is that we've got signs and procedures, and we're giving away masks, and we're doing everything short of being mask police. So anyway, just FYI, they're out there.
Yeah, and we were informed that the governor's office is actually the ones who have asked Liquor Control Board to take on this task. So yeah, that was one of my questions to all of you is, are you seeing more of those inspections? And the answer is yes. You know, and one thing I also just recently posted, and I wanted to draw your attention to it. In some cases, and based on my research, I really think this is going to fit. Most of your employees who cannot wear a mask and they have a medical note that clearly says they are unable to wear a mask for medical reasons, they could possibly fall into that high-risk worker that the governor has already issued a proclamation on, because they're obviously have health or medical issues that make them high risk. So I have put some guidance out there for workers with medical conditions who cannot work due to a mask mandate. And in there, it does identify what I was able to locate on that unfortunately, in those situations, the employer must maintain the employee's health insurance benefits. And that was through a mandate by the governor's office for high-risk workers. So I've put everything in there for you with links so you can really research it and see if you think that your employee falls under any of those examples that they give. But I did try to get something out there for you, and I will get more after my meeting with the attorney on this tomorrow.
Would that make that employee eligible for unemployment?
Yes, it would. Yeah.
So we do shoot the question about the mom who has symptoms. Where is the guidance about what they need to do once mom tests positive?
Okay, so on our COVID site, we have, and I don't know if Melissa's on the phone. She's the one that posts everything for us.
Kimmy, do you know the document name, and I can search for it really quick, or what it might be?
Yeah, it's the guidance for testing positive for COVID, and I'm pretty sure it has information about family members in there as well.
So it's under, I'll move it straight to featured this week. It's under the USBA, if that's the right one. So I'm gonna publish that right now. So it's, and Rebecca, you might need to refresh. If you go back to the COVID page, it'll be under, as long as my editor doesn't freeze. Okay, it should be under there if you refresh. It's the bottom document. Is that the one you're referring to?
Well, let me see here. I'm refreshing mine as well. Go to
I don't think so. I thought it was under our state guidance.
Isn't it called COVID exposed guidance? Under new this week?
Yes.
Oh, there it is.
Mm-hmm. Very good. Thank you.
Thanks, everybody.
That's why we're all a team here on this, right?
Yeah.
So yeah, that's under new this week, just on the main page.
Yeah, so this gives you some details on all of that, and close contact with someone who's tested positive, you know, and some of that. There's also additional guidance when you click on these links.
A quick question. I just went through an unemployment hearing with a person who's it was an employee whose husband has health conditions, and I'm pretty sure the judge is going to grant her unemployment. She was originally denied unemployment, but was there some process that the employer was supposed to go through to get relief of benefits for anybody that was out due to COVID?
Yeah, great question. And we did have a webinar. It's been a while back. And we talked to ESD. You will get a rate notice. And when you get that rate notice, it's going to specifically have or ask you to identify COVID related claims. And so you will have an opportunity to say, no, this is COVID related. So if you get a rate notice and it doesn't have any of that, I would protest it, and I identify all claims that are on there that are COVID related.
And so if it's a COVID-related claim, it's not supposed to go against your rate?
That is correct. Of course, we're all going to pay for it because it's going to be in that socialized tax, but it will not affect your experience rating for unemployment.
Or
I have
hopefully
yet-
for retro groups?
Totally different from the retro, but similar, like, you know, the factor that you pay for your unemployment.
Tammy, this is Carolyn. I just want to emphasize, though, to make it absolutely clear, you have to actually request for relief of benefit charges. It will not automatically, if it's COVID related, be taken off your charge. You have to make the request.
But I have yet to see this document, and I think that was quite a while ago that we had this interview, that document of saying, hey, list, here's all the people and let us know if it's COVID related.
Yeah.
You're going to get that end of August, I believe, beginning of September.
Okay.
Yeah, that was kind of the time frame they gave us, was around this August time frame. So knowing them, August, September, if they tell us early August. So yeah, right around there is when you should be receiving that.
So just to follow up, that she said that document doesn't have the information on what her responsibilities as an employer are, as far as can she still let this employee work currently?
Okay, people who have or are suspected. So on there, there's a link that says what to do if you have confirmed or suspected COVID. Let's see. You should stay home except to get medical care. Do not go to work, school, or public areas. Avoid using public transportation, ride sharing.
But is that with a confirmed someone who's confirmed to have been around COVID?
It says if you test positive or get sick after you are exposed to someone with COVID,
Right.
it says you can help stop the spread of COVID to others.
So I think what she's asking is right now, since there's no confirmation that mom is actually sick or has been exposed to COVID, can she let her work right now until there is some sort of confirmation?
Yeah, so there's no guidance that says they can't continue to work. It says that if you were exposed to someone who tested positive for COVID-19 and you have symptoms, you might have it. But it certainly doesn't say that you have to stop working during the interim until you have symptoms or until someone tests positive.
So yes, the person can still work at this point until the test results come back.
Well, for what it's worth, we have not allowed them to come back in that situation.
I was just going to say the same thing.
Yeah, I would rather just write them a check for whatever their work was going to be and pay them and have them stay home until they know that whether or not that test was positive or negative on their other family member.
Yeah,
especially now that the tests are 2 days. I mean, it should be 2 to 4 days to get the test results back. Not supposed to be that long.
Right. Yeah, erring on the side of caution, I think, is always best. I mean, you certainly don't want someone coming in and exposing everyone else, that's for sure.
We had a individual whose roommate was exactly the same situation. And he came to work and said, my roommate is having a temperature and, you know, she's going to go get tested, but we don't know. We send them home right away. And 2 days later, for sure, she did have COVID. So he's just staying home for another, 14 days.
Yep. Yeah, I definitely support being cautious with this, that's for sure. But there's no specific guidance other than what we have here on that. Anything else for the good of the order? Anything you would like me to research or look into before our next call? I'm hoping I can have some good news for you. Maybe the governor will have a plan for how we can start opening some more things up. But you know, at this point, we haven't received anything at all. If there are no further questions, you know, I thank you for all your time today and appreciate all the input and what everyone's doing.
Thank you.
Thank you. With that, have a great day, everyone.